Hello, my English-speaking friends. I am Taras Zherovetsky. I am doctor from Ukraine. I live in Lviv, the city in Ukraine. I'm a medical doctor. And I just want to tell you something about coronavirus in Ukraine. And what is the difference in management of patient in other countries and in Ukraine? What now we've got in Ukraine? First of all, in our country we've got a lot of cases of coronavirus, but not so many as in USA or as in UK. Also, what we've got now, we've got our family doctors who just try to manage the patients who are at home, and they prescribe treatment for the patients while they staying at home, while they having COVID. What we've got different from other countries. In many countries, family doctors or GP doctors just prescribe paracetamol to manage COVID and just to manage temperature. In our country, what we've got? In our country, our family doctors have a little bit different protocol, and what we just do. We do laboratory tests, for example, CRP, C-reactive protein, also D-dimers and ferritin, and we just know for the 7th day or 10th day of COVID, if these analyses are not so good, if the CRP level is high, ferritin level is high, and D-dimers are high, our family doctor prescribes some medication. For example, for a higher level of D-dimers, family doctor can prescribe anticoagulants, heparins. And if you've got a high level of ferritin, we can just think about a cytokine storm. And if you've got a higher level of CRP, C-reactive protein, the norm is 5 units. And if we've got, for example, 10 or 20 units of CRP, we prescribe antibiotic treatment. What we've got with this, we just, on my mind, we better just can manage patient with COVID at home. Because if the patient only take paracetamol or Nurofen, ibuprofen or Nimesulide, we cannot do this easily with only one drug and one medication. And in our country, for me, on my mind, we just make a different management of patient at home. That's why in our country we don't have such a lot of cases of hospitalization now. And that's why in the hospital we've got the same situation like in other countries in Europe, and the treatment is the same. We use the same treatment, protocol treatment, but at home we use another treatment, and sometimes that helps our system, our medical system, just to manage patients better and not to allow the patients to come to our hospital. What also we've got? We've got understanding of patient management with lab analysis, and also usually our doctors, if the status of patient is not very good, prescribe CT scans, CT observation, and that's why our family doctor can understand what the status of patient is. That's the system that works in Ukraine, but in other countries it works another way. That's why it seems to me that Ukraine now is more competitive for treatment at home, and we understand this situation with COVID better after the year of COVID in Ukraine. If you got some questions in English, please write me in the question in comments, or you can just call me on Messenger. Thank you. Bye bye. Have a nice day.